Hi, my name is Dr. Lindsay Ritter. I am one of the intensivists over at MedStar Washington Hospital Center, and I am here today to show you the new one-step Zoll pads that are going to be implemented in our hospital in the next couple of weeks. I'm going to discuss the main differences, which include pad placement and the presence of a sensor called the puck and where to place it. So the pads are going to be anterior pads. They'll be across the patient's front. There are some scenarios where you can use the pads in an anterior posterior fashion, and these would be if you need to cardiovert a patient or pace a patient. So the pads, the first thing you're going to do when you're going to put the pads on is to take a look at your patient's chest. The patient's chest should be dry, free from copious amounts of hair, which means you may need to use a razor to take some of the hair off if you have time. And if CHG has recently been applied, then you need to let it dry completely. So when the patient comes in, especially in the emergency department, EMS has their own set of pads that are similar to this. And you'll encounter a scenario where the patient will come in CPR in progress with a Lucas device, and the sensor puck is underneath the Lucas device plunger. If that is the case, we're going to leave that puck in place under the plunger. And if we obtain ROSC on the patient, when we're able to remove the Lucas device, we will move the puck to the side or to the patient's shoulder, as Lucas recommends that the plunger should be in direct contact with the patient's chest. If you have a patient in the emergency room who experiences a sudden cardiac arrest and you're placing the pads yourself, then you can place the puck again to the side or on the patient's chest if you're going to be using a Lucas device. So the way to open these pads, there is a yellow triangle here. You peel apart and then it opens up. You should see the two pads in place. To remove the pads, you're going to take the red tab and peel the pad off of the plastic. The first pad is a red rectangular pad, and it's going to go at the bottom of the pectoral muscle of the male or under the breast of a female, like this. Same thing with the second pad. You're going to use the red tab to remove it. And then taking care not to place it over the wires, you're going to align the puck, the cross here, where you would normally be placing your hands for CPR, so right at the patient's sternum. And then the triangular blue pad should fall into place on the patient's right pectoral under the clavicle. To connect the pad, you're going to take the piece from the pads and the connector from the Zoll, and on here you have a little triangle and you have some series of straight lines. You're going to place your thumb over the straight lines to lift the connector piece and then slide it into place with the Zoll.